Hello everyone, this is Vikram Buyyani. Today I am excited to present our hospital management system project. Our goal was to create a software system that streamlines hospital operations, improve patient care, and enhance healthcare professional experience. In this 10 minutes video, I will explain our business and technical requirements, use case and user stories, the diagrams we created, and the important concerns we identified during the project evaluation. First, let's start with the business requirements. We identified the following key requirements: streamline hospital operations to reduce administrative tasks and paperwork, to improve patients' care by providing accurate and timely information to healthcare professionals, enhance the experience of healthcare professionals by providing easy access to patients' information and reducing redundant tasks. Next, let's talk about the technical requirements. We identified the following key requirements. The system should be web-based and accessible from anywhere with an internet connection. The system should be secure and protect sensitive patient information from unauthorized access. The system should be scalable and handle a growing number of patients and healthcare professionals. Use case and user stories. To better understand the requirements and create an effective system, we developed several use case and user stories. The use case are as follows. Patients management. This use case involves registering new patients, scheduling appointments, and updating patients' records. The doctor management. This use case involves managing doctors' information, including their specialization, scheduling, and fees. Appointment management. This use case involves scheduling appointments between patients and doctors. Diagnosis management. This use case involves recording diagnosis made by doctors and attaching them to the patient's records. Treatment management. This use case involves recording the patient's treatment and medications for each diagnosis. The user stories we developed for the use case helped us to understand the system's functionality from the user's perspective. For example, a user story for the patient management use case might be: as a hospital administrator, I want to able to register a new patient quickly and easily so that we can provide timely and accurate care to our patients. Diagrams are a crucial part of any software development projects as they develop visual representation of the system and its components. The class diagram in particular is a tool used a model the system by identifying classes, their attributes and relationship between them. By creating a class diagram for our hospital management system, we were able to better understand the different components of the system and how they interact with each other. For instance, the class diagram helped us to identify the patient, doctor, appointment, diagnosis, and treatment classes and their corresponding attributes. We were also able to identify relationship between these classes, such as the fact that a patient can have many appointments, but each appointment is associated with only one doctor. In addition to the class diagram, we also created a data flow diagrams to help us understand how data moves through the system and the process involved. The data flow diagrams provided a visual representation of the follow information in the system. By creating data flow diagrams for the hospital management system, we were able to identify the inputs, outputs of process involved in the system. For example, we were able to identify that the patient information is an input to the system and that the process involved, including appointment, scheduling, diagnosis, treatment, and medication. The data flow diagram also helped us identify potential bottlenecks in the system. We were then able to address them. Overall, the diagram were crucial in helping us better understand the hospital management system and its components. They provided a visual representation of the system which helped us identify potential issues and provide the system design. By using the class diagram and data flow diagrams, we were able to create a system that was more effective and user friendly. During the project evaluation, one of the major concerns we identified was a potential vulnerability of the hospital management systems to cyber attacks. As the system contains sensitive patient information such as medical history and personal identification, it is critical to ensure that the system is secure and protected against potential threats. Hackers can exploit vulnerability in the system's code or infrastructure to gain unauthorized access to the system and steal sensitive patient information. This could result in legal and ethical issues such as violating patients' privacy rights and also patients' trust. To mitigate the system vulnerability, we recommended implementing security protocols such as encrypt of sensitive patient information, limiting access to the system servers, and monitoring the systems for any suspicious activity. Additionally, regular security audits and assignments could be conducted to ensure that the system remains secure and protected against the potential threats. Overall, ensuring the security and protection of the sensitive patient information is crucial for the hospital management systems effectiveness and maintaining patients' trust. By uh, addressing the concerns, we have provided better care to patients while promoting fairness and privacy and transparency in the system's operation. In summary, our hospital management system project aimed to streamline hospital operations, improve patients' care, and enhance healthcare professionals' experience. We identified key business and technical requirements, developed as use case and user stories to understand the system functionality, and create several diagrams to visualize the system components. While evaluating the project, we identified the important concerns of the system's vulnerability to cyber attacks, which we addressed by implementing security protocols to protect sensitive patient information. Overall, we are proud of the work we have done and we are excited to see the positive impact this system will have on healthcare operations and patients' care. Thank you for giving this opportunity.